Jerry Trzeciakowski. I'm a professor here at the Texas A&M College of Medicine, and I've been teaching medical students for almost 4 years now. I've been asked to present an important problem that you may experience when you're dealing with treating elderly patients, and that is the issue of polypharmacy. So what is polypharmacy? Well, it refers to the effect of taking multiple medications at the same time. But particularly, people are concerned about the inappropriate use of multiple medications, that is, more than those are really medically necessary. So we're going to find that studies show that about 37% of all outpatients over the age of 75 are on 5 or more medications, and 37% are on 9 or more medications. Numbers from nursing homes, hospitals are about the same. You know from your lectures in geriatric pharmacology that aging can affect drug absorption, distribution, and metabolism. These changes, when you combine them with the increased number of medications that these patients can be taking, increases the risk of serious adverse drug-drug interactions to about 80%. And if you're on 8 or more drugs, it's almost a statistical certainty that there is going to be some type of adverse interaction. In fact, it's estimated that about a third of ambulatory older patients experience at least one adverse drug-drug interaction each year, and almost 30% of those require a trip to a clinic or even the emergency department to handle the side effects. It's estimated that in 2016, about 60% of all emergency department visits were attributed to adverse drug-drug interactions. So this problem is widespread and it can be quite serious. What can you do as doctors to reduce the problems associated with polypharmacy? Well, first, I recommend that you do a brown bag check. That is, you have your patient bring all of their current medications with them when they come to their clinic visit. This gives you a chance to review these drugs for potential drug-drug interactions and clear up any confusion over the medications that they are taking currently, or those that maybe have been discontinued and the patient still thinks that they need to be on them. Second, you can look up a publication called the AGS Beers Criteria, that is the American Geriatric Society's Beers Criteria for potentially inappropriate medications in older adults. So this lists all of the drugs that really should be avoided in older patients, and it gives a nice set of tables of all of the potential drug-drug interactions that you should be aware of when administering these drugs. When you're doing your brown bag check, inform the patients of any dietary restrictions that they need to be aware of when they're taking these drugs. Warn the patients of any potential side effects, including telling them when they need to come see you in the clinic or go to the emergency department for these side effects. Advise your patients to use only one pharmacy to fill their prescriptions. This provides an additional important check against adverse drug-drug interactions and incorrect dosages. Instruct your patients to take the medications as directed and to inform you or any other healthcare provider if any changes occur in their lifestyle or their noticing side effects that may be caused by these drugs. Remind them to adhere to the regimen, to take their drugs as necessary. And for those that may forget, there are handy devices that can pick up at their pharmacy. 7-day pill boxes are very handy. I use these myself, where you place your daily medications in each box. And for me, it helps me remember that I've taken it. You know, if I can't remember, did I take that or not, I just look at the box and say, okay, well, it's still there or it's empty, and it serves as a good reminder. For those that need more reminding, for about $20, there's something called a Tab vibrating pill timer that will actually go off like a cell phone and remind them when it's time to take their medication. If they have a smartphone, there is a MediSafe medication reminder. It's a free application for iOS and Android that not only reminds you when to take the medication, but tracks the number remaining and will give them a reminder of when to get a refill. Alternatively, you can teach the patients to link their dosing schedule to their daily activities. For drugs that have to be taken twice a day or 3 times a day, it's very simple to link that to getting up in the morning, going to bed at night, or with daily meals, breakfast, lunch, and dinner. So those serve as important memory triggers, particularly in elderly patients who have trouble remembering to take their medications. So those are some of the helpful tips that I've come across, and I hope that you will have success in implementing those when you're dealing with your elderly patients. Thank you.